want to provide good care. We want to provide what we would consider standard of care. The ultimate goal is the patient outcome. And I think what we do a great job at in county is hiring people who are all of that same mindset, that we really want to provide something to the community with our expertise where patients are going to do better.
My name is Jimmy Ye. I am the Chief of the Division of Hematology and Medical Oncology here at Harbor-UCLA. I'm also the Program Director of our Fellowship in Hematology Oncology here at Harbor-UCLA. I like the people I work with. I like that we're all on the same team, that we're all motivated to do the best for our patients. And I think by nature of you're in the trenches with everyone together. There's a lot of adversity our patients face, so there's a lot of adversity in the system, but we all have a common bond. It's the patients we take care of.
My name is Catherine Chen. I'm one of the surgical oncologists here at Harbor-UCLA. Treating cancer patients is really multidisciplinary. Most cancer patients aren't going to be treated with just surgery alone, but surgery typically plays some component in the treatment path for our cancer patients. My job is to help with, diagnosing patients, making sure that they get the correct biopsy or making sure that they get the correct tests for diagnosis.
At the time that we're providing a diagnosis, typically we're involving our Cancer Navigator program or somebody from that program. And sometimes it's resources, sometimes connection with a local food source or housing, transportation, any of the various things that can support a patient. The navigators can usually provide some resource to the patient. Our pharmacy physicians, really, their primary role is going to be in dosing and administering or preparing chemotherapy for patients. We're getting fancier and fancier with some of the chemotherapies. 20 years ago, some of the chemotherapy was very basic, and now we have chemotherapy regimens that there are 2 or 3 different, 4 different things that are given all sort of together. And our clinical pharmacists become really important in the dosing and administration of those. Dietitians are a really important part of the extended team. Certain diets are actually better for certain types of cancer. And so involving a dietitian to try to meet some of those goals. Another sort of group of specialists that is really important to our patients are our physical therapists. So many of the surgeries we do can lead to patients needing extended recovery, especially if you're going into a surgery somewhat frail. Our physical therapists then need to work with those people to get them back up onto their feet and more mobile and sort of regain that function that they may have lost. Very often we're seeing patients from the Hispanic population and Asian communities that are coming in as not speaking, certainly not enough English to communicate a medical diagnosis and discuss some complicated, treatments. So we need to have those conversations in their language in order for those to be productive and safe and, meet all the goals for the patient. So we rely a lot more heavily on having individuals come to our clinic, which they're so gracious and available to do, and have those conversations with us one-on-one to the patients.
A lot of us have the same sense of mission of helping underserved people, of just helping people in general.
Everybody is very focused on the patient doing well, providing that evidence-based pathway to a good outcome as much as possible.
I want our patients to know that they are not alone, that there are multiple other people that are going through the same thing that they're going through. Sometimes it feels like, why me? Why did I get this? Why did this happen to me? And unfortunately, it's very common to be diagnosed with cancer, whatever type of cancer. We want our patients to know that other people have gone through it. We're here to help. We're here to support you.
I want to thank them for trusting us in their care of them. I think the cancer it's a hard disease to face. And it's so challenging from a medical, social, psychological perspective. It's probably one of the most terrifying diseases anyone can really face. It's hard on the patients, it's hard on their family members. And so I just appreciate that their trust in us being able to do our best providing care for them.